new sicknesses and diseases every day. Some of these can even be life-threatening. With countless daily illnesses presenting themselves without a cure, why do we neglect some remedies that prove to work? One controversial antidote for many natural and unexplained illnesses has been the recreational use of marijuana. The legal use of marijuana for medical intentions has been a lengthy contention in proving to be a beneficial apparatus in the medical world. The reason as to why the legalization of marijuana has not been passed in all states is irritating but understandable. Some states have much more strict laws against marijuana than other states do, making the process much more difficult but not impossible. States like Arizona, Georgia, and Florida currently lead the country in strict cannabis codes, with felony and misdemeanor charges that have up to $5,000 fines as well as possible jail time. The negative viewpoint on marijuana may be the most difficult task of the process, but is not a viewpoint that is immobile. The biggest factor as to why marijuana is viewed so negative is because it is classified as a drug, and because of how shallow the thought of drugs are in today's America, any new drug passing will be arduous to form. Although that is the case in most perspectives, marijuana is not a new drug to the medical world and needs no further proving to show its beneficial factors. The beneficial factors that marijuana present positively affect both the mind and body. The endocannabinoid compounds found in marijuana help in establish moods in which ease mental conditions like depression and anxiety. The use of the drug has also helped individuals who may fight diabetes or wish to prevent all possibilities in acquiring. The American Alliance of Medical Cannabis has linked marijuana to stabilize blood sugars, lower blood pressure, and improve blood circulation. These are health problems that do not always have prescriptions or cures, and more times than not, marijuana has proven to help in countless related situations. Tammy Malone, a columnist writer from Pain News Network, writes about her battle with chronic pain and how it had gotten so painful she had contemplated suicide. Finally, after visiting her doctor, she was prescribed opioids, and although her pain had shortly gotten better, her opioid medication had halted, and because of the ongoing war against opioid medications, she was going to have to find a new way to deal with the chronic pain. Shortly after her medication cut, Tammy moved to Montana, where her husband and her parents had helped her transition to the use of medical marijuana. Tammy writes that the use of marijuana had taken her daily pill doses from 44 a day to only 7, and hopefully, soon that number converts to a 0. She describes how lucky she was finding a compassionate doctor to prescribe her to medical marijuana, and just how much of a positive effect it had on her body, describing the pains going from an 8 to a 4. Marijuana is not a drug that should be overlooked or neglected when discussing its medical benefits. It has proven to be a valuable tool in body pains and mental health. Marijuana should be looked more as a medical variable than a harmful drug. Scientists are conducting preclinical and clinical trials with marijuana and its extract to treat symptoms of illness and other conditions such as seizures, inflammation, and even diseases like HIV. These tests help navigate the minds of the medical field in comprehending the beneficial factors that marijuana may attain and have yet to prove to attain. In 2018, 67% of doctors were in favor of using marijuana for medical purposes, and 85% of American adults approve of medical marijuana when luckily given the opportunity. For quite some time, scientists have studied the cannabinoids found in marijuana and have fortunately forged 2 FDA-approved medications that contain cannabinoids. So far, researchers haven't conducted enough large-scale clinical trials to 100% prove the pros of medical marijuana outweigh the cons. But when given enough attention and reason, the American people and government will comprehend how beneficial medical marijuana really is. With better understanding of marijuana, we can change the negative narrative around the drug and save more lives than we did yesterday.